So the clinic is overall great. We kind of can do it all from an outpatient perspective. We have the 23 exam rooms, so there's lots of room for all the patients that we kind of go through throughout the day. We have the 2 OMM procedure rooms, so we can do our own OMT in the clinic as well. We have 2 procedure rooms just for other kinds of procedures, such as kind of minor surgical care, colposcopies, vasectomies. We've even done some circumcisions. We can remove skin biopsies as well, next one on placements, IUDs, all those kinds of things. The other nice part about the clinic is we have our own lab, so we can take blood work, urine, all that kind of stuff, either right before you see the patient or right after the clinic appointment. Also, we have our own x-ray, which is great. That's the other nice part about having all that in-house is, I don't know how many times, today included, where I'm ordering tests and labs and I order something wrong or the lab wants clarification, or if I'm like, hey, what's the best way to x-ray this? I can go ask the x-ray tech and even watch them perform it and kind of have some input as well there. So everyone's always really easy answering questions.
I think it's really nice that there's an in-house pharmacist, because whenever I have a question about medications, dosing, anything like that, like what interactions I need to watch out for, basically anything that I can think about, I can just go walk down the hall and talk to our pharmacist, Dr. Farber, and just ask him like, hey, I want to start these medications. Anything I should be concerned about? What doses do you think I should do? How long should I do it? He has all the answers that I could possibly want.
I feel like the procedures in the clinic, we definitely have access to learning and getting better at several procedures. A lot of the times when we have a continuity patient for OB, we will follow that pediatric patient, the new pediatric patient, right? And then we will do the circumcision while they're in the hospital just before discharge. We've done that several times. And it's nice to be able to talk to the parents, talk them through it in the hospital, do the procedure on the patient, and then follow up with them in clinic.
For our patient population, some of the other things that we can provide as a clinic is we do have our own food pantry and also our own clothing closet as well. It's just another way that we're able to kind of look at the patient as a whole and kind of looking at things that also affect their health, whether it's clothing, food, and just provide those resources for our patients. We have a patient population that has some unique challenges, and being able to provide these resources for them is something that's very beneficial and helps also the other things that go along with your health when looking at the full patient.